Hi, I am Dr. Rajshekhar C. Jaka, consultant surgical oncologist, robotic surgeon and breast surgeon. Today I will be talking on the assessment of a breast lump. All lumps are not cancerous lumps, so we don't have to be too much worried about it, but a proper assessment will give us a good idea what kind of lump is it. The important examination, that is known as triple assessment, means there are three things which are must for any breast lump to come to a conclusion like what kind of lump is it. First thing is clinical examination by an expert doctor. Most often it should be done by an oncologist or an oncosurgeon or a surgeon. Only then the proper evaluation, examination of a lump can be done. The second thing is mammogram. Mammogram is an X-ray mammogram and sonomammogram. X-ray mammogram usually we do above 40 years and sonomammogram is done below 40 years. The most important thing here is, even if it is not detectable by our hands, sometimes we will be able to know microcalcification, architectural distortion or some changes in the mammogram. That is why mammogram becomes very important investigation tool. The third thing is core biopsy. I often see many patients or females getting FNAC, fine needle aspiration cytology, and majority of the times the diagnosis may be inconclusive because FNAC takes very few cells and sometimes it is difficult to come to a conclusion. So the best biopsy technique or best technique to say that it is a cancer or non-cancerous is core biopsy or true cut biopsy. Here we have nowadays all automated guns. So it's a daycare procedure. It is just a OPD procedure. It will hardly take 10 to 15 minutes, but we get most accurate diagnosis. Not only diagnosis, here we will also be getting the important hormonal receptor study status, that is estrogen receptor, progesterone receptor or HER2/neu receptors. They are known as ER, PR and HER2/neu receptors can also be studied on this core biopsy itself. They have got a very important implications in the treatment and prognosis. So it is important that all breast lumps should be diagnosed with a core biopsy, not by FNAC. So with this triple assessment, we will be able to come to a conclusion that yes, it is a cancerous or non-cancerous variety. So next is staging. Staging can be done by either ultrasound or CT scan or bone scan or PET CT scan. When we choose what kind of investigation is, if at all we feel that it's a very early lesion, probably it might not have spread. In that case, we will be using probably CT scan of the chest and bone scan. This is to assess whether it has spread to the bones or lungs. And sometimes we use PET CT scan, which is the most advanced scan which scans whole body. We want to know whether it has spread to the brain, whether it has spread to the lung, bone or anywhere in the abdomen or any part of the body for that matter, and the lymph nodes. It is very important that we stage the cancer before we start the treatment, because sometimes even though we can do the surgery, we don't do surgery if the lump is big or if the lymph nodes are big, because we give chemotherapy which is known as neoadjuvant chemotherapy. We reduce the size of the disease, then we operate, then results are better. So that is why it is important that we stage the disease and then proceed with the treatment. Thank you.